Hi everyone, I'm Dr. Heidi. I'm a dermatologist and pediatric dermatologist. More importantly, mom of 3 little ones, and I would love to bring education about your kids' skin to you. So let's get started. Today we're going to talk about a pesky little lesion called pyogenic granuloma. Let me tell you a story. So what about that insect bite that never goes away? So I had a patient recently, a little cutie pie, whose parents said that he got a whole bunch of bug bites, but then the one on the cheek wasn't going away, and as a matter of fact it bled a lot. There was blood on the pillow. So obviously as mom or dad, you would get nervous about that. You're like, what is this? Why is my child's face bleeding? I would get nervous about that too, except for I'm a pediatric dermatologist, so I know what that is, but I completely understand how nerve-wracking that would be. So these lesions are called pyogenic granuloma. They're just a collection of blood vessels, newly formed, not dangerous, not cancerous. They kind of form at any part of the body. They can happen at any age. Usually, however, they are formed at site of trauma, and that trauma could be a bug bite. So they were absolutely right that it used to be a bug bite, but now it's not a bug bite because it has induced another lesion, a growth of tiny little blood vessels that are now traumatized and are bleeding. So PGs usually pop up as these little tiny red blebs, again, anywhere on the body. Sometimes we don't even know what the trauma was, we don't remember it, or we don't know it, or we can never find out why they happened, but they happen. They're very common in kids. Again, nothing to worry about. Even the bleeding part, even the blood that comes out of them, it's not at a level that could cause problems. What can you do when you see a lesion like this? So usually parents notice it because it's bleeding and then it causes a lot of stress. So what you do is that you take a little bit of ointment, Vaseline or any other ointment, you put it on the spot and you hold a cold washcloth on it for 10 minutes. No peeking, no looking. Most of the things that bleed from the skin can be stopped with direct pressure for 10 to 20 minutes without peeking. But how do you make a cold compress? You can use an ice pack, put it inside a washcloth and hold it. Just pressure alone will also do the trick. So that's how you stop the bleeding. In a rare case it doesn't stop, then you would have to go into an urgent care or doctor's office to have the base of it be burned. But if they're not bleeding and they're just there and you're worried about it, then you would want to consider treating them because they don't usually go away on their own. So what are the treatments that are available? Most commonly, we cut them off and burn the base. Not to worry because we will numb the area and your child will not feel the cutting or the burning. We could use numbing creams, or you could use a tiny little injection of numbing medicine. We numb the area and then we shave it off. That piece has to go to lab. We're getting sidetracked now, but it's super important as a dermatologist to tell you anything that gets cut off of your body or your child's body has to go to laboratory to be evaluated. There is no such thing as just cutting something and dumping it into trash because we know what it is. No, we don't 100% know. Everything that comes off of your body has to go to a laboratory for another doctor, another specialist called a pathologist to look at it under the microscope and tell you exactly what it is. That's so important. Anyways, so that piece that we cut off will go to the lab. We burn the base with a tiny little tip that has heat or electricity, however you may want to think about it, and just kind of burns those blood vessels so there's no future bleeding. And then it'll scab over and it would heal. Kids' skin is very forgiving and the scar usually is not a problem. What if you do not want to do an invasive procedure and you're like, doctor, give me a medicine? There is 2 kinds of medicines we use on it. Both of them are prescription. Both of them are off-label use, but both of them work. None of them are 100%, but we just have to see if it works or not. We have to use it for 2 or 3 months and then kind of gauge it. Both of them are pretty safe. I've used them on a lot of kids and I'm comfortable prescribing it to anyone's child. So those are the 2 medical treatments. And then there are lasers. There are different kind of lasers that you can laser these lesions. That's also an option, but again, has to be done by professional dermatologist or pediatric dermatologist or a laser dermatologist. However, you usually cannot laser off the larger lesions or the ones that are bleeding. So the ones that are bleeding, we kind of prefer to remove them, but the ones that are tiny or, you know, like in an area where it's cosmetically super elegant, then we could try the lasers. And then sometimes pyogenic granulomas come because you are on a medication. Some medications are known to cause pyogenic granuloma. So your doctor can also talk about that if that seems to be a factor in it. So tiny little blobs of blood vessels that look like they're a bug bite, but they're kind of persisting. They may be bleeding. Apply pressure and then see your dermatologist for removal of it. If you have any questions, let me know. Subscribe to this channel. Let me know what subjects you want me to cover.